Hi and welcome to the channel. Thank you so much for tuning in. My name is Rute and I'm a medical doctor. Today we're going to talk about something very common. We're talking about vaginal thrush, also known as vaginal yeast infection. It is so common that up to 75% of women would have had thrush at some point in their lifetime. So it's nothing to be embarrassed about, but I thought this video would be really useful to know more about what is thrush, what causes it, how do we treat it, how can you help prevent getting thrush, and also when is it time to see the doctor. What is vaginal thrush? So thrush is a fungal infection caused by the yeast Candida. Now Candida is part of the normal vaginal flora. But what can happen is if there is too much Candida, too much overgrowth of that yeast, that is what leads to a vaginal yeast infection. So what can cause you to have too much Candida, too much overgrowth of that yeast? So it's anything that is going to disturb the normal vaginal flora, which is like the normal pH of the vagina. So there are multiple things that can do that. Although when women have vaginal yeast infection, it's not very easy to pinpoint and say this is what caused you to have the vaginal yeast infection. So things that can disturb the normal vaginal flora include things like washing the vagina with soaps, with shower gel, strong things that can irritate the vagina like perfumes, scented moisturizers, douching, and things like that. So all of this can irritate the inside of the vagina. The vagina can do the cleaning by itself, so you don't need to wash the vagina. And when I say the vagina, I mean the inside. So I'm not talking about the vulva, which is where your lips are. And again, if you're going to use soap around the vulva, around the labias, the lips, then you want to make sure that you're using things that are very simple. So you're also more likely to get thrush if you've had some antibiotics, because antibiotics work by trying to kill off the bad bacteria, but they can also kill off the good bacteria, and so disturbing the normal vaginal flora. Also, if you've got uncontrolled diabetes or you're immunocompromised, so meaning you've got a condition like HIV or cancer, or you've been on steroids for a very long time for a particular treatment, that can make you more prone to getting thrush. So what are the symptoms of thrush? So one of the most common symptoms is itching. You just notice that your vagina is itchy, your vulva is itchy, you're just itchy down there, and it can be so uncomfortable. And this is the part where a lot of women feel embarrassed, because it doesn't matter where you are, you can feel really uncomfortable, and you find yourself trying to scratch by shifting your position when you're seated or altering the way you're walking. So it's a really uncomfortable itch. So that's one of the first signs of having thrush. Another symptom is soreness. It's just really sore there and uncomfortable, and this can be made worse when you itch. And you find that sometimes if you pee, it can burn. One, because it's just really sore there. So when you pee, the urine is touching the vulva, so it's touching your lips or your labias, and so you find that it is really stinging. And that's why sometimes when you see your doctor, they might also want to do a urine test just to make sure that it's not a urine infection, because pain or stinging when you pass urine can be a symptom of a urine infection, as well as other things. Not only that, if it's really sore down there, it can be really difficult to have sex and make it painful. So you find that it is painful during initial penetration, so that's suggesting that it's quite sore down there, and it might be that you've got thrush. But then again, pain during sex can be caused by other things. Another symptom is discharge. Now, not everybody who's got thrush will have discharge, but if you do have discharge, you might notice that your discharge is a bit more thick, a bit more white, and sometimes it gets to a point where it looks like cottage cheese. So it's really white, it's really thick, and it looks like cottage cheese. So that might be a sign of thrush. The discharge also doesn't tend to smell, so that's one of the differentiating factors that might push it towards it being thrush, as opposed to another type of infection where you may get different types of vaginal colored discharge or smells, and these might indicate other things. And I've got a different video on the other channel which talks about different types of discharges. I'll put a link to that in the description so you can watch it after this video. Some people, if they have really severe thrush, they might notice that those symptoms I've described are really, really bad, and maybe they've also got quite a lot of cuts around the area, their vulva is swollen. And if you notice that, it's really important to speak to your doctor, because then you might need a different treatment regime. So we've talked about what is thrush, what are the symptoms, and what causes it. So now we're going to talk about the treatment. You have two main treatment options, and generally you can decide which one you want. The only difference is if you're pregnant, then you can't take the oral tablet. So the treatment options, as I've mentioned, is oral, so taking the tablet. So you just take a one-off tablet, which you can get from the chemist. The other option is where you put the medication in the vagina. Now those, it's not the same medication, they're different types. If you pick oral, you get given the oral version. If you pick the vagina one, you get given the one to insert in the vagina. So the one you insert in the vagina, similarly, it's one dose. So you just put it at night. Well, you can put it during the day as well, but usually recommend you do it at night, because once the medication works in the vagina, you will get a bit of the residue of the medication discharging out of the vagina, also mixed with your vaginal discharge. So I would recommend that you use a pad or a panty liner. There are different brands that you can buy from the chemist. So if you just speak to the pharmacist and just say, I've got thrush, I would like to have the medication that you put in the vagina. This tends to come as a pessary, so then they'll give you the options and then you can pick. So the applicators look different. So this is an example of one of them. So it's like that. This one is pre-packed with the medication. And so what you do is, you probably lie on your back with your knees apart, and then you can do it yourself. So you put this in here, and then you squeeze it through into the vagina. Some of them you have to put the medication yourself. So it comes with an applicator and a pessary. So then you put the tablet at the end, and then you squeeze it into the vagina. Those are the two main types of treatments. Most of the time, especially because women tend to complain of an itchy sore vagina, I always recommend a cream on top of that. So again, they're different brands you can buy from the chemist. So it will come in a little tube. You just squeeze a bit on your finger and you apply it 2 to 3 times a day. I'd recommend that you use it for a number of days. This really helps to ease that itching. You might find that the first time that you apply the cream, it stings. That can be expected. It doesn't mean you should stop. I would recommend that you continue, unless of course it's stinging a lot, it's giving you a reaction, you've got a rash or anything like that. And if that was to ever happen, make sure you speak to your doctor about it. That's a common treatment for most women. If, for example, you're having thrush for the first time, or you've had thrush a year ago, you had thrush 2 years ago, or you had thrush 6 months ago, and you want to have the treatment again. When is it time to see a doctor? So firstly, if you've treated yourself at home and you're comfortable, you're confident that you think this is thrush, you've treated yourself at home, but after about 7 to 14 days, your symptoms have not resolved, it's important to speak to your doctor. Then we're likely to offer you another treatment. If your symptoms don't add up and you're worried, it is important to speak to your doctor so that we can make sure that it is thrush. So we'll ask you some questions, because there are other conditions like sexually transmitted infections or urine infection that may present similar to thrush. If you're pregnant and you think you have thrush, it's important to speak to your doctor. If you're having recurrent episodes, so that is 4 or more episodes in any 12 months, then you need to speak to your doctor. 1, we want to make sure that it's thrush that you've been treating, and 2, it might mean you just need a different regime to treat the thrush. Also, if you've got a medical condition like diabetes, if you've got HIV, if you've been on steroids for a long time, if you've got cancer and you think you have thrush, it's important for you to book an appointment and speak to your doctor. Also, if you're less than 16 years old or you're more than 60 years old, it's really important that if you think you've got thrush, to speak to your doctor, because it's not as common in those age groups and we want to make sure that it's nothing else. So what are the things that you can do to try and prevent thrush or reduce the frequency? So firstly, as I mentioned before, thrush happens when the vaginal flora is disturbed. So what can you do? If you douche, I would recommend not douching, not using strong soaps or scented products around the vulva, in the vagina. Just wash the vulva with a cloth and water or a simple soap, and don't wash the vagina because the vagina will clean itself. Other things that you could do is wearing loose fitting clothing or cotton underwear, because it's known that a moist and warm environment can increase the amount of candida and cause you to have thrush. What are the commonly asked questions when it comes to vaginal thrush? People tend to ask if you can pass it on to your partner, and the simple answer is yes, you can pass it on to your partner, although it's still not classified as a sexually transmitted infection. Also, it's important to note that when you're on treatment for thrush, so if you've been given a pessary or a cream that you put into the vagina, they can cause damage to the diaphragm or the condom. So it's important to be extra careful. The other commonly asked question is, what tests can I do to see if I've got thrush? Generally, us doctors don't do any tests. If we think you got thrush, we're more than happy to treat you as such. But if there's any doubt, or we think it might be something else, or we just want to double check, or you've got other symptoms that might mean it might be a sexually transmitted infection, or as I said, a urine infection, then we might do some tests. So what would that test involve? So it will involve us doing a swab, which you can do yourself at home, or we can do for you, and we'll send that to the lab. I do know that a lot of women do buy test strips from over the counter, so from supermarkets or pharmacies. It's not something that we do in practice because we don't need to, but if you feel like it's something that you want to do, you want to try, it is up to you. But from a doctor's point of view, you don't need to. Thank you so much for watching this video. I hope you found it useful. Please make sure you subscribe if you have not subscribed. I do intend on posting more videos on different health topics, including women's health and general health as well. So we're going to talk about bacterial vaginosis, fertility, high blood pressure, menopause, loads of different things. So please make sure you subscribe if you have not subscribed, and share this video to others as well. Please subscribe.